And I'm sure what you had to say was very important. I appreciate you. Okay, let's get to this. In a landmark ruling out of New Mexico, a jury orders Meta, it's the parent company of Facebook and Instagram, to pay $375 million. This is after finding the company liable for misleading users about safety and enabling harm to kids. So this includes exposure to sexual exploitation, dangerous content on their platforms. Licensed therapist Dr. Morgan Francis, who you knew very well, friend of 12 News Today and AZ, joins us to help us understand what this means for families and what we need to learn from all of this. You know, this was a huge case, especially the fact that the jury ruled in favor of Meta, or excuse me, in favor of the people who were, going after Meta, which has not happened before, because typically these companies just say, parents, this is on you, not on us.
Absolutely. We've been gaslighting parents for so long. Blaming it on parents, saying it's your fault that the kids are struggling with social media, when this trial was a landmark and showing that actually Meta has designed social media to keep kids and teenagers engaged due to the specific algorithm that it is created and the high scrolling that happens. So it creates this reward system that's impossible for teens to remove themselves from, even when they are experiencing negative feelings. And that's the really key piece to this, because it has created such intense messaging around body image concerns, their mental health, and high sexual content.
This is huge. What, in your practice, do you hear from families who deal with the negative effects of social media, and what is your advice to them? How do you work through it?
I do. I just had a father call me saying that his son was the victim of predatory online behavior, and he was just devastated.
Yeah.
I've had many parents reach out. I've had teenagers say that it's so hard for them. They know they don't feel good while they are scrolling on their social media. And for teenage girls specifically, they are comparing themselves to other girls online. And when they don't look like the filter, or when they don't look like the avatar that may be shown to them, they feel bad about themselves. So we are seeing an increase in anxiety and depressive symptoms and isolation. So one of the big things is that we will see teenagers and children be on their phones inside their bedroom and behind closed doors.
Yes.
So, it's not so much about how much time they are spending on social media, as we used to really criticize parents for, but what they are seeing and how that is affecting them.
Oh, it's just awful. Are there parameters that you think, with your practice and the people that you've talked to, that really work, that you're seeing success in, where they're lessening the addiction, or where they're able to turn their focus to other things? What do you think?
Yeah, so it's really important that parents start to be okay with being uncomfortable about having these really tough conversations. I've been coaching a father about how to talk to his teenage son about the sexual content that his son was exposed to. So really starting to be aware that you're gonna have to ask, what are you watching, and sit down next to them and watch with them. And then also, let's not have anything behind closed doors. Really putting, let's say, some parameters, like you said, around when they are on their phone, so not when they're going to bed.
Yes.
Taking the phone out of the room, charging the phone in a different area, and you as the parent putting guidelines about how much time they can spend and when the internet actually shuts off on their phone so they can't access the internet.
Is there a script that you give to parents to follow to get that conversation started? Because social media is still like kind of the wild, wild west, where we just don't really know exactly what our kids are seeing, exactly how to approach the subject. How do we even start with that conversation?
So I think a lot of parents fear that they're not going to say the right thing, so they don't say anything at all.
Yes.
So I take the pressure off it having to be perfect. And it's okay if you don't address it right in that moment. You might just also be shocked about what is going on for your child. And it's okay to take a moment to really think about, how can I make sure that my child is safe? Because safety is the #1 priority when it comes to online activity.
All right, Dr. Francis, thank you so much for your time. It is good in these cases and others that have now worked their way through, that Meta is finally, hopefully, going to set up some more parameters for our kids to make sure that they're safe online. Thanks again for your time. If people are interested in speaking with you, where can they go?
So my practice is Scottsdale Premier Counseling, and I'm in Scottsdale, and they can reach out to me at any time. I'm also online, and they can look for mental health resources. I give a lot of free educational resources for folks to access.
Great. Thank you so much. Absolutely. All right, everyone. We're going to